Hello. So this lesson begins chapter 7, which is the leg and foot. So anatomically speaking, when we say the leg, we are not talking about from the hip down to the foot. We're actually only talking about the knee down. The thigh is the portion of the leg, the distal leg portion. So anyway, the portion from the knee to the hip is actually called the thigh, and then from the knee down is called the leg, anatomically speaking. So it gets a little confusing when we talk about the leg and we mean the whole thing, or when we talk about the leg and we just mean from the knee to the ankle. But anyway, in this chapter, the leg means just from the knee to the foot. So that's what we will be covering in this chapter. I'm going to go ahead and start the screen share. We are going to go right into the chapter. There it is. Okay, so this is page 346 in your book. We're going to start with the bones. Now, we do have to do the bones of the foot as well, but I'm going to do a separate video for that. Okay, right now we're just going to do the tibia and fibula, essentially. All right, so we have the leg, which is this part right here. And of course, the tibia articulates with the femur. This is the tibia right here. It's the larger of the two bones, this one. And then we have the fibula, which is the long, skinny lateral bone here, this one, that does not articulate at the knee. So only the tibia articulates with the femur. And that's kind of important. The tibia and fibula do articulate at a place called the proximal tibiofibular joint and the distal tibiofibular joint. So they do connect together, so at the proximal and distal ends. But again, only the tibia articulates with the femur at the tibiofemoral joint. Okay, and then of course the patellar covers the knee joint, and later on in this chapter we'll talk more specifically about the knee joint itself, the structures contained therein, and of course disorders associated with injuries to those structures. Okay, so in the meantime we have the tibia. It's a pretty big bone, not as big as the femur, but the tibia, or I'm sorry, the fibula on the other hand is really skinny compared to the tibia. It's long, it's slender. It's more for stability and muscle attachment. Okay, one last thing before we move to the next slide. The top bone, or the more superior bone, let's put it that way, of the foot and ankle is called the talus. So where the tibia and fibula articulate with the talus is called the talocrural joint, and that is your ankle, the talocrural joint. Remember that crural area, the front of the lower leg? Yeah. Okay, so as far as landmarks on these are concerned, we don't actually have too many, which is kind of nice. So if we start on the tibia, we have two little prominences right here. I think I showed these to you before in another video, just briefly. They're right at the top there, and we'll see these more clearly in class. These are the medial and lateral intercondylar tubercles. So they're sticky outy things, they're tubercles, okay? Then we have these flat areas here and here, which are here and here. Those are tibial plateaus. They are not labeled as such. You may add that label if you like, but they're high flat areas, which is exactly what a plateau is. So these are tibial plateaus here and here, okay? Pieces of C-ring, of cartilage, one shaped like a C, one shaped like an O, are gonna sit on the tibial plateaus. Okay, we do have condyles. So if we're looking at an anterior view of the tibia, which is this one here, we have the tibial tuberosity right in the front here. We know what that is because that's where the quadriceps tendon attaches. We have the lateral condyle and the medial condyle. Okay, lateral condyle and medial condyle. There's a mosquito in here. That is fascinating. Okay. Lateral condyle is going to be on the side opposite of this big piece down here, and I'll explain that in a minute, okay? But you have the lateral condyle, and then you have the medial condyle here, and the tibial tuberosity right in the middle. Then you have that little spot, sort of lateral and a little bit inferior to the tibial tuberosity. That's the pes anserinus tendon, okay? And again, you can tell this is medial. My bone's opposite and it's messing me up. I need to get a different bone, okay. All right. Tibial tuberosity, pes anserinus attachment site, because that's where we have attachment for 3 separate muscles: gracilis, sartorius, semitendinosus. Remember that? Yes, of course you do. Across from that, we have the head of the fibula, okay? The head of the fibula is towards the top. That makes sense, right? And then we just have the shafts of the fibula and the tibia. There's not a whole lot going on in the shafts because it's all going to be covered by muscle, which you'll see. There's actually quite a bit of muscle there. When we get down to the bottom here, we have the medial malleolus, and again, mine is opposite to what's on the screen there. The medial malleolus, okay, is right here. And as I mentioned before, if we go straight up, this is going to be the lateral side. This is going to be the medial side. Okay, this is the medial malleolus. This is going to be your medial ankle bone. So that big bone down on your ankle on the medial side that you whack on things, that's the medial malleolus. The fibula is the lateral malleolus. So the bottom part of the fibula here is the lateral malleolus or lateral ankle bone. Okay, you have one on either side. You can feel them, they stick out. So the one on the tibia is the medial malleolus. The one on the fibula is the lateral malleolus, okay? We come up here to a posterior view of the tibia and fibula. We have the same kind of things, right? Here's the lateral side of the tibia. Again, because look, here's the medial malleolus. That's easy. Head of the fibula, shaft of the fibula, shaft of the tibia. What you have on the posterior of the tibia, however, that you don't have on the anterior is a soleal line. The soleal line is kind of like, kind of a little like the gluteal tuberosity. It's actually more pronounced, or like the linea aspera, something like that. It's a little bit thicker, so you can see it on the bone. And that's going to be an attachment site for soleus. We move down to the inferior portions. Again, we have the same kind of things: lateral malleolus, medial malleolus. There is a little bit of a groove for some tendons here. I'm not really concerned that you know that. It's not a technical landmark. And then right in here, there's a little fossa of the lateral malleolus. It's a, I don't know if you can see this here. It is a pretty big dip right there. Nice fossa right in there. It's going to articulate with the talus. Okay. And then we have a little bit of landmarks for the patella. It's kind of shaped like a heart, I think. So the base is the top, which is odd, and the apex is the bottom part of the heart. And on the posterior side, you have a medial facet and a lateral facet. The word facet or facet means face, little face. That's all that means. Perhaps you know that word from jewelry, like facets on a diamond or gem. Again, it's the same kind of thing. Facet just means little face. Okay, so that's all we're going to do for the tibia and the fibula right now. The next video will be the foot by itself. All right, I will see you soon.